In today's Health Connection segment, we're talking about foot pain. Dr. Kevin Larson from the Grand Island Foot Clinic joins us now live from our Grand Island newsroom. Good to have you.
Thank you, Colleen.
Dr. Plantar fasciitis has been in the news a lot lately, especially with a recent injury to the Denver Bronco quarterback Peyton Manning. Can you explain what is it exactly?
Yeah, plantar fasciitis by definition is inflammation of the plantar fascia. And the plantar fascia is a strong supportive structure, kind of like a ligament that connects from on the bottom of your foot from your heel out towards your toes. And the function of the plantar fascia is to support the arch, and it also helps in shock absorption. Typically, if people say they have heel pain, what that would mean is they usually have plantar fasciitis, because it is by far the most common heel problem that we treat. Peyton Manning, on the other hand, he doesn't have plantar fasciitis. He actually tore his plantar fascia. So,
I see. Who is the most susceptible to this?
The most susceptible patient would be usually athletes, especially runners. They typically have trouble with plantar fasciitis. And then also people who do a lot of standing on unsupportive or really hard surfaces like concrete for extended periods of time. They would tend to be the candidate for developing plantar fasciitis.
Is this different than a heel spur? Because one time I had something and it felt like I was standing on a tack on my heel. Really painful.
Yeah, I mean, a heel spur is just an X-ray presentation of a spur that's on the heel bone, but heel spur syndrome is plantar fasciitis plus the heel spur, and they're both treated the same. It is different, but it's treated the same as plantar fasciitis.
Let's talk about varying degrees of pain that's associated with this. Hurts just a little to a lot? What do you think?
Yeah, typically the typical plantar fasciitis patient will have significant pain after periods of rest. So if you sit in a car and drive for 30 minutes and get out and go, or you go to sleep at night, wake up in the middle of the night to go to the bathroom, or wake up in the morning, that very first step that you take is usually the most painful time. And then after you start walking on it, you kind of stretch it out a little bit and it starts to feel a little bit better. And then if you have a job, for example, where you're on your feet quite a bit, towards the end of the day, you might find that it starts to bother again for you.
Let's quickly talk about some treatment options that are out there.
Well, typically the first line of treatment is stretching, icing, anti-inflammatories, over-the-counter ibuprofen or Aleve usually can help. We always recommend good supportive shoes, good arch supports, and that would be the first line of treatment. If that doesn't work for you, then we consider a prescription or a custom arch support. Physical therapy can be very effective at helping. Rest is always good. And then some of the more aggressive things that we do would be cortisone injections. There's some minimally invasive surgical procedures that we like to do for people who, no matter what we've done, are not getting better. Usually that's about 15 to 20% of our population. And so there's some neat new techniques. One of the procedures that we do is called 10X, where we make a puncture into the heel and are able to get the desired effect through just a small puncture surgically.
Oh, that's great to hear. We have Dr. Kevin Larson from the Grand Island Foot Clinic for today's Health Connection segment. Thank you so much for your time.
Thank you.
And we're going to be right back with sports.